Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
Being a pathologist, but also being a Black pathologist, is momentous to see this actually happening and at such a large scale.
Dr. Latanza Adams is talking about the end to race-based testing for chronic kidney disease. In the past, African Americans were tested differently than their white counterparts, leading to poor healthcare treatments and increasing disparities in Black communities. March is National Kidney Month, and in today's Healthier Together, we want to talk about this important change.
Patients were appearing sick, very sick, and they didn't have the right eGFR. It was too high. So they couldn't get a transplant, even though clinically they met every other criteria. It's just this particular one that they didn't meet, so they were denied that opportunity.
Dr. Adams is a member of the College of American Pathologists and a pathologist for the Portland VA Medical Center. She's seen firsthand how putting race into the equation has led to poor treatment for Black people, including her own father, who she lost to kidney disease.
He was very proud, very strong, would do anything for you.
Her dad had the two most common risk factors for kidney disease: diabetes and high blood pressure. He also had a stroke. She says he would go to the doctor doing everything you're supposed to do. They tried to get him seen by a specialist, but he couldn't get a referral. He got so sick he needed to go to the ER. And that's when they found out his kidneys were failing.
After doing those simple blood tests, one of them being eGFR, we were told that he was in end-stage renal failure and he needed emergency dialysis.
Her family immediately started looking into treatments. Latanza was ready to give him her kidney, but they didn't have a chance to get to that point.
One of the things that they said was he doesn't qualify right now because he wouldn't even survive the surgery. He doesn't have enough reserve.
And the College of American Pathologists says that's an outcome for many Black Americans because of race-based testing for kidney function. eGFR, or estimated glomerular filtration testing, is a blood test commonly used to assess kidney function. For years, Dr. Adams says the test used race, sex, weight, and creatinine, a breakdown product from muscle and protein metabolism. But here's the problem. Racial bias became part of that equation. The myth that African Americans have more muscle mass, thus making more creatinine, added a multiplier for Black people.
So the problem with that was it made those that were Black seem that they had a higher kidney function or a higher glomerular filtration rate than their non-Black counterparts.
That's further disparities for Black folks in healthcare, preventing them from early interventions, treatments, and transplants. Now, the College of American Pathologists are taking race out of the equation. And it's part of Dr. Latanza Adams' job to ensure providers are up to date on the change. She hopes this will prompt the medical community to address other ways racial bias has become common practice in healthcare.
There's many other examples of where race has weaved its bias into the medical care.
And she reminds all of us to take charge of our own health and make sure we're harnessing the power of pathologists to get tested for kidney disease.
With anything, early detection is key.
For more information, go to kgw.com/healthiertogether.